What's the difference between getting a general anaesthetic and being sedated? This is such a good question. I'm like,
how long's a piece of string?
exactly.
I think sometimes.
Yeah.
Myself, I'm actually probably going to tap out of this question slightly because I'm not sort of super familiar because I know that there are certain guidelines that I think in certain position statements that have been released on this that I'm not entirely familiar with. So I think that I might leave this one to you if that's okay.
Oh, okay, sure. Tell me what you think. So I say it's a spectrum. So at one end, we're wide awake, and at the other end, we're fully anaesthetized under a full general anesthetic. And we can kind of imagine what happens at the end when we're wide awake. If you have a few too many drinks, and we might have all seen someone like that who starts looking a bit drowsy, they're slurring their words, they're not, that to me classes as a category of sedation. Alcohol is a sedative.
Well and truly.
And then if you see someone who's maybe had even more drinks, they're kind of lying on the floor, snoring deeply, and it's really hard to wake them. So again, that's a deeper level of sedation. And then because we're anaesthetists, we can keep pushing it. And sometimes we can push it to the point that you're under a general anaesthetic. The difference between us and someone doing it at home with alcohol or whatever other sedative medicines is we're a bit more scientific about it.
Yes.
The medications we use are reversible, usually with time, sometimes with specific reversing agents. And we're making a more educated guess about how this particular medication is going to interact with that patient on that particular day. So while most of us can kind of relate to that lighter end, being fully awake and lightly sedated, I think the same nuance and subtlety occurs at that very deep end between general anesthesia. And we see it all the time as anaesthetists. So we're like, yes, it's deep sedation. But that's really hard for someone in the public to picture.
It's also very hard to know where to necessarily draw that line because it's just a spectrum. And
exactly.
So how long is a piece of string and where exactly do you kind of call those definitions can be quite hard.
Exactly. And you can't base it on any one factor.
No.
So I'll often say to people, I can give you a medication which stops you forming memories, but you'll still be talking to me and you'll be what I call lightly sedated, comfortably aware of your surroundings, nothing's worrying you. But when I speak to you tomorrow and I say, what's the last thing you remember? It could have been way, way earlier. And you don't remember that great conversation we had about coming to the NSC and how fantastic Canberra was and all these things.
I've noticed it particularly when doing ice because the patients are like the vast majority of the time awake type thing, but sometimes there's sort of a little bit of light sedation on board and they'll say that they were completely knocked out when they had their other eye done and they want the same thing again. And you look at the records and there was just a tiny little dose of medication.
Yeah,
they would have been
smidge,
awake, but just don't remember it.
And it's just that particular medication knocks your memory more than it does make you more sleepy and unconscious. So you can't pin it on memory. You can't pin it on any one thing. It's the whole picture that we put together.
Even airways, like you can't really, sure, if you're intubating someone, you're probably going to be asleep, but at the same time you see people in ICU all the time with intubated and they're sort of awake, they're communicating well and tolerating it fine.
Correct. It's the whole package. So that's a very long piece of string. Well done.